Hello, and welcome to our channel. If this is the first time you are visiting our channel, please consider subscribing. We create and share high-quality and informative medical videos that will help each one of us make healthy choices and decisions in our daily life. We welcome all of you and appreciate your support and encouragement. We are committed to producing more medical videos that will benefit all of us. Thank you. In today's video, we will talk about ovarian cancer, breast cancer, and bladder cancer. In the first part of this video, we will focus on talking about ovarian cancer, the second part will be about breast cancer, and the third part will be about bladder cancer. Each topic consists of some of the most important questions and some life-saving tips and information that you need to know about these three cancers. Therefore, make sure you watch till the end of this video. So, let's get started with ovarian cancer. Here are the 10 questions and topics we will be covering in the first part of this video. From the answers to these 10 questions, I promise you will surely discover some life-saving facts and tips about ovarian cancer that you need to be aware of. So, here are the questions. Number 1. What is ovarian cancer? Number 2. Why are we talking about ovarian cancer? Number 3. What are the three types of ovarian cancer? Number 4. How is ovarian cancer diagnosed? Number 5. How fatal is ovarian cancer? Number 6. What are the top 5 signs and symptoms of ovarian cancer that you need to be aware of? Number 7. What are some complications of ovarian cancer? Number 8. What are some risk factors for developing ovarian cancer? Number 9. What are the top 5 tips to reduce the risk of ovarian cancer? Number 10. What is the role of flavonoid diet in ovarian cancer? Now that we went through the questions we will be covering in this video, we can get started answering them. So, what is ovarian cancer? First, let's talk about ovaries and their role. The ovaries are part woman's reproductive system, and there are 2 of them. They are located on either side of the lower abdomen. At the midpoint of each menstrual cycle, these 2 ovaries produce and release eggs into part of the female reproductive tract, the fallopian tube, where fertilization by a sperm may occur. Where does ovarian cancer occur? Ovarian cancer starts inside the ovaries and then becomes a cancerous tumor that grows outside the ovaries, and the cancer cells divide uncontrollably. This is when it destroys nearby tissue or even spreads to other parts of the body, such as the liver, lungs, spleen, uterus, bladder, sigmoid colon, intestines, brain, and other organs in the body. So, why are we talking about ovarian cancer? Ovarian cancer is considered one of the silent killers. This is because women who have cancer may not be aware of it until it spreads to other organs in the body. Therefore, it absolutely makes sense to take preventative measures because of its high mortality rate, particularly if you have a family history of this cancer. Ovarian cancer affects around 22,500 American women each year, according to the American Cancer Society. Also, according to the National Library of Medicine, ovarian cancer affects around 7,500 women in the United Kingdom every year, and also 6 in 10 cases of ovarian cancer are diagnosed in the later stages, stages 3 and 4. Know that we defined ovarian cancer. What are the three types of ovarian cancer? Ovarian cancer is categorized based on where the cancer started. Therefore, these are the three categories. Number 1. Epithelial tumors. These tumors start in the thin layer of tissue that covers the surface of the ovaries. Epithelial tumors represent up to 90% of ovarian cancers. Number 2. Stromal tumors. These tumors are known to be diagnosed at an earlier stage of cancer in comparison to ovarian tumors. These tumors start in ovarian tissue and represent about 7% of ovarian tumors. Number 3. Germ cell tumors. These tumors start in the egg-producing cells. These types of tumors are scarce and known to occur in younger women. Now that we know about ovarian cancer and its categories, we can move to talk about some diagnostic techniques and technology that specialists use. So, how is ovarian cancer diagnosed? For ovarian cancer diagnosis, a doctor may use many different types of tests and exams. Number 1. Pelvic exam. The purpose of this exam is to check any visible abnormalities. This exam involves checking the vulva, vagina, cervix, ovaries, uterus, and rectum. Number 2. Imaging tests. These tests include ultrasound, computed tomography, positron emission tomography. These tests show the size and the shape as well as the structure of the ovaries. These tests also detect any pelvic masses. To determine if ovarian cancer has grown and spread, the doctor uses colonoscopy, chest X-rays, magnetic resonance imaging, also called MRI. Number 3. Blood tests. In the blood of ovarian cancer patients, there may be high levels of certain tumor markers in the blood, such as CA125. This is the protein that is found on the outside of ovarian cancer cells. Therefore, this blood test confirms the existence of this protein. This blood test is also used to detect chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase in the blood. Number 4. Biopsy. This biopsy test is mostly used to make a definitive diagnosis after completed the above-listed tests. This is when the doctor obtains tissue and abdominal fluid samples for the pathologist to examine them closely using a microscope to determine the presence of cancerous cells. Know that we know the three types of ovarian cancer and how it is diagnosed. How fatal is ovarian cancer? As I mentioned before, ovarian cancer can spread very quickly to other organs. This is because its symptoms can be mixed up with other health conditions or illnesses. This makes it very challenging to detect and diagnose, which leads to delay in medical interventions and treatments, and therefore it spreads to other organs in the body. And this is when the cancer becomes fatal. Whenever we develop a health condition, our body gives us some crucial signs and symptoms that we need to watch for. So, what are the top 5 symptoms of ovarian cancer that you need to be aware of? Number 1. Pain. The types of pain we are talking about here are unexplained cramps, painful pressure in the pelvic area, abdomen, or stomach. These types of pain can be continuous and severe. This is when you seek medical attention and intervention. Note, never assume these symptoms are related to your menstruation. Thus, make sure you get medical advice from your doctor. Number 2. Urinating more frequently than usual. This is one of the direct effects of ovarian cancer, and this is when you feel the need to urinate more frequently, but little comes out when you go. You may even experience difficulty in holding urine on your way to the bathroom, and also urges can come on quickly. You may also experience urinary leakage without even trying to pass urine. Note: frequently urinating may also be associated with a urinary tract infection, UTI, or an overactive bladder. However, if this sign is a new health condition to you and continues for days, make sure you seek medical advice from your doctor because it can be serious if ignored, being one of the signs of ovarian cancer. Number 3. Unexplained bloating and abdominal distension. Ovarian cancer can produce gas and block it from being released, leading to abdominal bloating that can be uncomfortable. If this symptom is new to you and persists for days, make sure you seek medical advice. This is because bloating can be associated with fluid buildup in the abdominal cavity at the end stage of ovarian cancer. The degree of abdominal distension may range from mild to severe, accompanied by mild indigestion. This bloating mostly occurs daily, and it can even get worse with time. You may not be aware of this bloating until it is too late. Therefore, it is crucial to pay attention to your clothes and check if they are tight around your waistline, knowing that you haven't gained any weight recently. Note: if you developed unexplained and expecting abdominal distension, you may develop stretch marks. Also, never assume that the bloating you are suffering from is related to age, or menopause, or from gaining a couple of kilos. This is because unexplained bloating can be an early sign of ovarian cancer, especially if you feel bloated for more than 2 days. Therefore, if you ignore this symptom, it will lead to serious and complex health conditions. Number 4. Unexplained lower back pain. If this sign is new to you and you didn't have problems with back pain before, this may be a serious sign that you need to pay attention to, especially if it is similar to labor pain. This is because when cancer spreads outside of the ovaries, it causes lower back pain, and this pain is mostly from tumor growth and the tumor compressing on other organs in your body. Number 5. Constipation. This symptom is often overlooked by so many women, associating it with other health conditions or food-related problems. However, when the ovarian tumor spreads, it can cause constipation, and this is by putting pressure on the bowels. Therefore, constipation is a typical sign of ovarian cancer. Thus, it is very critical to pay attention to any changes in your bowel habits, especially if it is new constipation that doesn't go away, even with interventions that you may have tried. Number 6. Vaginal bleeding. The bleeding we are talking about here is the bleeding that is no normal, such as heavy bleeding, irregular bleeding, and bleeding between periods, particularly after menopause. You may even experience frequent discharge from the vagina, and the color of this discharge can be clear white or colored with blood. Number 7. Pelvic pain or pressure. This is a very tricky symptom because it resembles the pain you would get when you have menstrual cramps, but this pain can be an early sign of ovarian cancer. This kind of pain may be confined to one side, but can also be felt all over your pelvis. Therefore, make sure you consult your doctor if this pelvic pain persists for few days, particularly if accompanied by a feeling of pressure in your pelvis. Number 8. Pain with intercourse. This is called dyspareunia, and it is a common sign of ovarian cancer. However, this symptom can also be related to pelvic inflammatory disease. Therefore, it is best to always consult your doctor for a proper diagnosis. Suffering from any cancer results in some complications that can be very challenging to deal with medically. So, what are some complications of ovarian cancer? Ovarian cancer can be very severe when it spreads to other organs in the body, leading to some complex complications. Thus, it is vital to be aware of the complication of ovarian cancer and seek medical interventions and treatments as soon as possible. Some of these complications are: Number 1. Bowel obstruction. When ovarian cancer spreads to the abdomen and pelvis area, it leads to bowel obstruction. This is when you feel crampy abdominal pain and even vomiting. Number 2. Perforated colon. When ovarian cancer metastasizes into the intestines wall becomes weak, which leads to bowel perforation. This is when bowel contents leak into the abdominal cavity, leading to an infection called peritonitis. Number 3. Blockage of a ureter. When cancer spreads to the pelvis areas, it leads to the blockage of the tubes that travel from the kidneys to the bladder. These tubes are called the ureters. If both of these tubes are blocked, urine output will drop, leading to urinary retention. Number 4. Pleural effusion. When cancer spreads to the lungs and the chest area, cancer causes the fluid, sometimes containing cancer cells, to build up between the membranes that line the lungs. This is when the specialist performs a procedure called thoracentesis, where a needle is placed through the skin on the chest into the pleural cavity so that the fluid can be drained safely. Depends on the situation, the specialist may place a stent to allow the continuity of the fluid drainage. Knowing that most women get ovarian cancer without being at high risk, so, what are some factors that may increase the risk for developing this cancer? Some of the risk factors that may increase the risk of developing ovarian cancer are: Number 1. Even though all women are at risk of developing ovarian cancer regardless of their age, ovarian cancer rates are highest in middle age or older. Number 2. If you have one of your family members who have had ovarian cancer. These may include your sister, aunt, or grandmother on either your mother's or father's side. Number 3. If you have an inherited genetic mutation in one of two genes, breast cancer gene 1, BRCA1, or breast cancer gene 2, BRCA2. These genes are accountable for about 10 to 15% of all ovarian cancers. Number 4. If you previously had breast cancer, uterine cancer, or colon cancer, you are at high risk of developing ovarian cancer. Number 5. If you have never given birth or have had difficulty getting pregnant. Also, having your first child after the age of 30 may increase the risk of developing the cancer. There are no known ways to prevent ovarian cancer completely. However, certain things may reduce the risk of developing ovarian cancer. So, what are some ovarian cancer risk-reducing factors that you should be aware of? Number 1. Diet. It is crucial to know that eating an overall balanced diet and maintaining a healthy weight are critical dietary factors in reducing the risk of developing ovarian cancer. When you combine an active lifestyle with certain foods, this will reduce the risk of developing this cancer. The types of food we are talking about here are foods that are high in vitamin D, such as salmon, beans, eggs, nuts, and cod liver oil. Also, other types of food you would want to integrate into your diet are vitamin A-rich foods, such as carrots, leafy greens, and sweet potatoes. Note: any food you integrate into your diet, make sure you consume them in moderation, because overeating them can lead to counter effects that would affect your health. Number 2. Oral contraceptives. According to the American Cancer Society, women who used oral contraceptives for 5 years or more have about a 50% lower risk of developing ovarian cancer than women who never used them. However, it is vital to make sure you consult your doctor before you start taking oral contraceptives, because they have side effects that you need to be aware of. Number 3. Avoiding carcinogens. Carcinogens are substances that can cause various cancers. One of these substances is talcum powder. The International Agency for Research on Cancer classified talc-based powder use on the genitals and buttocks as possibly carcinogenic to humans. Talcum powder is found in everyday products such as baby powder, vaginal deodorants, and makeup. Therefore, avoiding carcinogens could decrease your risk of developing ovarian cancer. Number 4. Hysterectomy. This surely lowers ovarian cancer risk with or without oophorectomy. Oophorectomy is the surgical removal of the ovaries. Number 5. Breastfeeding. If you have done breastfeeding for at least a year, this lowers the risk of developing ovarian cancer. According to the Cancer Network, breastfeeding is found to be associated with a 24% lower risk of invasive ovarian cancer. Now that we went through some risk-reducing factors of ovarian cancer, what is the role of flavonoid diets in ovarian cancer? Camphorol play a big role in inhibiting the growth of ovarian cancer. Camphorol is a natural flavonols, which have been found to have anti-cancer activity. This is because they have the ability to inhibit cell proliferation, angiogenesis, and metastasis while promoting apoptosis, which is a process used to clear the body of cells that have been damaged and that are beyond repair. Some fruits and vegetables that are rich in flavonoids include berries, Brussels sprouts, broccoli, cabbage, grapefruit, kale, onions, apples, tomato, red grapes, tea, and more. Before moving to talk about the second part of this video, which is breast cancer, here are some questions to think about in regards to ovarian cancer. Number 1. Do you think ovarian cancer affects pregnancy or will affect the growing baby inside? Number 2. Do you know of some food that you think would slow the growth of this cancer? Now that we covered some of the most important information about ovarian cancer, we can move on to talk about breast cancer. The questions and topics we will be covering about breast cancer are: Number 1. What is breast cancer? Number 2. What are some signs and symptoms of breast cancer? Number 3. What are some risk factors for breast cancer? Number 4. What foods would you want to integrate into your diet to lower the chances of developing breast cancer? Let's get started. So, what is breast cancer? Breast cancer begins in the cells of the breast. Breast cancer can either be a tumor, where it grows into and destroys nearby tissues, and it can even spread to other parts of the body. Or it can be non-cancerous, benign, where it does not grow into other tissue and therefore behaves normally. Some breast cancers begin in cells that line the ducts that carry milk from the glands to the nipple, and this type of cancer is called ductal carcinoma. When cancer starts in lobules, which are the groups of glands that make milk cancer, it is called lobular carcinoma. Even though both types of cancers can be benign and do not grow into surrounding tissues, they can, however, be invasive, as they can invade other surrounding tissues and organs. Now that we defined breast cancer, so what are some signs and symptoms of breast cancer that you need to watch for? Some women who have breast cancer may not exhibit any signs or symptoms in its early stages. Therefore, They would only know that they have breast cancer when the tumor grows large enough to be felt as a lump in the breast, or when cancer spreads to nearby tissues and other organs. Note: you may be having other health conditions that can cause similar symptoms as breast cancer symptoms. So, what are some signs and symptoms of breast cancer? Some signs and symptoms of breast cancer include: Number 1. You may notice changes to your skin's texture. Breast cancer causes so many changes in the breast. One of them is inflammation in skin cells. This inflammation leads to texture changes, including scaly skin around the nipple and areola. Thus, the skin may feel like it is sunburned. Note: you may even notice skin thickening in some parts of the breast. Number 2. You may notice nipple discharge. This discharge can be either thin or thick. The color of this discharge varies. It can be clear to milky, yellow, green, or red. Note: it is always recommended to consult your doctor whenever you notice a discharge from your nipples. This is because this discharge may have nothing to do with having breast cancer. Instead, it may be related to so many other things such as breast infections, a side effect of birth control pills, or other medications that you may be taking, or it may be related to some other health conditions, such as thyroid disease, or other diseases. Number 3. You may notice dimpling in your breast. This dimpling can signify inflammatory breast cancer, which is an aggressive type of breast cancer. This is when breast cancer cells build up lymph fluid in the breast, leading to swelling and dimpling or pitted skin. One of the easiest ways to identify this dimpled skin is that it resembles the surface of an orange. Thus, it is vital that you consult your doctor when you observe dimpled skin for further investigations. Number 4. Lymph nodes changes. First, let's define lymph nodes and their roles. Lymph nodes are located in many parts of your body, and there are hundreds of them. Some parts of the body where you would find these lymph nodes include neck, armpit, and groin. One of the roles of these lymph nodes is that they contain immune cells that fight bacteria, viruses, and cancer cells. When breast cancer has been developed, its cells travel to the underarm lymph node region on the same side as the affected breast, and these cancer cells cause lymph nodes to swell, especially in the armpits and around the collarbone. This swelling can be characterized as small and firm swollen lumps that may be tender when touched. Note: breast infections or other health conditions may cause lymph tissue to swell. Therefore, it is recommended that you contact your doctor about these changes, so that your doctor can identify a possible cause of swelling of the lymph nodes. Number 4. Breast pain or nipple pain. Even though breast cancer is usually painless, it can cause some changes in skin cells that lead to a feeling of pain, tenderness, and discomfort. Thus, never ignore the pain you may feel in your breast or nipples, as it could be one of the signs of breast cancer, especially if you have excessive pain along with some of the other signs and symptoms of breast cancer. Regarding ductal carcinoma, one of the ways you would know that you have developed this type of cancer is when you feel a firm or hard lump that feels very different from the rest of the breast. Thus, if this lump continues and it doesn't disappear, you should consult your doctor. Regarding lobular carcinoma, this type of cancer does not usually form a lump that would warn you. After going through some of the signs and symptoms of breast cancer, it is imperative to note that breast changes you may be experiencing can be caused by so many factors, including aging, breast infection, changes in hormone levels, and other health factors. Therefore, you should not panic or be fearful when you notice these breast changes. However, it is advisable to proactively arrange a routine visit to your doctor and get medical advice about your health conditions and symptoms you are having. Now that we went through some signs and symptoms of breast cancer, we can move on to talk about some risk factors. What are some risk factors for breast cancer? One of the things you need to be aware of is that having a risk factor does not mean you will definitely develop breast cancer. If you are concerned about some risk factors that you may have, it is recommended to talk to your family doctor about ways to lower your risk. Your doctor may recommend screening tests and exams for breast cancer. So, what are some risk factors for breast cancer? Some risk factors for breast cancer include: Number 1. Age. Research and statistics have identified that breast cancer is mostly diagnosed after the age of 50. Thus, the older you get, the more likely you will develop breast cancer. Number 2. Genetic mutations and abnormal genes. It has been reported that about 5% to 10% of breast cancers are related to abnormal genes that are passed from parents to children. For example, women who have inherited genetic changes BRCA1 and BRCA2 are at higher risk of developing breast cancer. Number 3. Family history of breast cancer. Women who have relatives who have been diagnosed with breast cancer are at high risk of developing breast cancer. Number 4. Previous exposure to radiation therapy. If you have had radiation therapy on your chest or breasts before you reach age 30, you are more likely to develop this cancer. Now that we talked about some risk factors for breast cancer, we can talk about how diet affects this cancer. We know that healthy eating affects our well-being, and if we follow an unhealthy diet, this can lead to so many health conditions. One of them is obesity, which raises your odds for breast cancer. Therefore, it is vital to integrate types of food that your body benefits from and use them when needed. Some of these foods are vegetables, whole grains, chicken, and fish. But, let's be more specific and talk about the types of food you would want to integrate into your diet to lower the chances of developing breast cancer. Some of these foods are: Number 1. Leafy green vegetables. Some leafy green vegetables with anti-cancer properties include kale, arugula, spinach, and mustard greens. This is because they are rich in carotenoid antioxidants, such as beta-carotene, lutein, and zeaxanthin. These types of vegetables have been proven to reduce breast cancer risk. Number 2. Citrus fruits. Citrus fruits are very rich in folate, vitamin C, and carotenoids like beta-cryptoxanthin and beta-carotene. They are also rich in flavonoid antioxidants like quercetin, hesperetin, and naringenin. These nutrients all play a big role in protecting you against breast cancer. This is because they all have antioxidant, anti-cancer, and anti-inflammatory effects. Number 3. Fatty fish. Some studies show that eating fatty fish may specifically reduce your risk of breast cancer. This is because fatty fish are very high in omega-3 fats, selenium, and antioxidants such as canthaxanthin, which all have cancer protective effects. Some of these fatty fish include salmon, sardines, and mackerel. Now that we talked about breast cancer and learned some tips and information about this disease, we can move to the third subject, bladder cancer. Here are the 6 questions and topics we will be covering about bladder cancer. From the answers to these 8 questions, I promise you will surely learn some life-saving facts and tips to help you better understand this cancer. So, make sure you watch till the end to learn all about it. Let's get started. Number 1. What is bladder cancer? Number 2. What are some signs and symptoms of bladder cancer that you need to watch for? Number 3. What are some factors that may increase bladder cancer risk? Number 4. How is bladder cancer diagnosed? Number 5. Is there a diet that would be recommended for people who are diagnosed with bladder cancer? Number 6. Can water put you at high risk of developing bladder cancer? Number 7. What is the prognosis for bladder cancer, and how fatal is it? Number 8. What are some treatment options for bladder cancer? Before we start talking about bladder cancer, we first need to define it. So, what is bladder cancer? First, let's talk about the bladder itself. The bladder is part of the urinary system. It is a hollow organ in the pelvis that stores urine before it passes out of the body. Many conditions can affect the bladder. Some of them are cystitis, which is an inflammation of the bladder due to an infection, and urinary incontinence, which is a loss of bladder control. Some signs and symptoms of a bladder infection are pain or burning sensation while urinating, urgent urination, which is an overwhelming need to get to a bathroom immediately, even when your bladder isn't full, having trouble urinating, and frequent urinating during the night. These symptoms can be cured accordingly by your doctor. However, bladder cancer is a health condition that can be fatal if ignored. Bladder cancer begins in the cells of the bladder. This cancerous tumor that consists of cancer cells can grow into nearby tissue and organs. According to the National Institutes of Health, approximately 45,000 men and 17,000 women per year are diagnosed with this cancer. When suffering from bladder cancer, your body exhibits certain signs and symptoms that warn you about cancer, so that medical interventions and treatment can be initiated on time by medical professionals. So, what are some signs and symptoms of bladder cancer? Signs and symptoms of bladder cancer include: Number 1. Blood in the urine, which is called hematuria. This is one of the most common signs of bladder cancer. This is because it is often the first sign in the early stages of cancer. The source of this bleeding comes from inside the bladder, where the tumor is bleeding. You could see bright red blood, orange, or pink-colored blood. This bleeding can occur regularly or intermittently. There may be a situation where you have blood particles in urine, but they are invisible to you, and this is when the doctors ordered a urine test called urinalysis, when those blood particles could be detected microscopically. Number 2. Frequent urination. A person with bladder cancer may feel the need to frequently or urgently urinate outside the norm. For example, the norm urination frequency for adults is 4 to 8 times a day. Even though this sign can be a sign of bladder infection or other health condition of the bladder, it can also be a sign of bladder cancer. Therefore, make sure to see your doctor to rule out bladder cancer. Number 3. Urinary retention. A person with bladder cancer may experience urinary retention. The urinary tract obstruction is caused by the tumor or the development of blood clots in the bladder, as one of the complications of cancer. This causes the person to have difficulty urinating when the urge arises, and even having a problem initiating a urine stream. Number 4. Pelvic mass. This may not be felt in the early stages of the tumor in the bladder. However, in the later stages, the doctor may be able to locate a mass that can be palpable in the pelvis. This mass indicates that cancer has spread to other organs and invaded the deeper layers of the bladder walls. Number 5. A person with bladder cancer may suffer from weight loss. When the immune system tries to fight the cancer, releases substances called cytokines. These released substances can affect a person's metabolism, resulting in the loss of muscle and fat. Number 6. Anemia. Anemia occurs when the blood is deficient in hemoglobin, which is a protein in your red blood cells that carries oxygen to your body organs. This hemoglobin is responsible for transporting oxygen through the bloodstream. Therefore, a person with this cancer can suffer from being anemic. This is because when there is a growth of the malignant tumor in the body, these tumors deplete the body of vitamin B12 and iron. This low iron in the body can lead to shortness of breath, swelling of the hands and feet, and a rapid heart rate. Number 7. Pain and irritation when urinating. Besides bloating and discomfort in the lower abdomen and pain in the back and pelvis, a person with bladder cancer often experiences pain and irritation when urinating, which causes a burning sensation. This is very common in the early stages of bladder cancer. So, what are some factors that may increase bladder cancer risk? A risk factor is anything that increases a person's chance of developing cancer. The risk factors for bladder cancer do not directly cause cancer in most cases, but they can often influence the development of this cancer. The following factors may raise a person's risk of developing bladder cancer. Number 1. Tobacco use. We all know that tobacco use harms your health in so many ways and leads to so many health problems. In regards to bladder cancer, cigarette smoking is considered the most common risk factor for cancer. Note: smoking cigars and pipes can also put you at high risk of developing this cancer. According to the American Society of Clinical Oncology, smokers are 4 to 7 times more likely to develop bladder cancer than non-smokers. Number 2. Age. As you get older, the risk of developing bladder cancer becomes high. According to the American Society of Clinical Oncology, more than 70% of people with bladder cancer are older than 65. Number 3. Gender. Regarding gender, it is imperative to note that while men are 4 times more likely to develop bladder cancer than women, however, women are more likely to die from it than men. Number 4. Race. White people are more likely to be diagnosed with bladder cancer than black people, although black people experience poorer survival outcomes once diagnosed. Number 5. Chemicals. Exposing yourself to the chemicals aromatic amines can increase the risk of bladder cancer. The sources of these chemicals are rubber, leather, paint, manufacturing plants, tobacco smoke, commercial hair dyes, and diesel exhaust. Number 6. Drinking water from a well that has a large amount of arsenic or drinking water that has been treated with chlorine can increase the risk of developing bladder cancer. Number 7. If you get bladder infections frequently, especially bladder infections caused by schistosoma hematobium or using urinary catheters, for a long-term or permanent, you have a high risk of developing bladder cancer. Diagnosing bladder cancer begins with a visit to your doctor, who will ask you about any signs and symptoms you be experiencing. Based on this information, your family doctor would order some tests to check for cancer or other health problems that your symptoms are related to. Also, your family doctor would refer you to a specialist who will investigate the cancer further. Note, the whole process of diagnosis may be overwhelming and may seem long to you. However, it is essential to remember that it is better to be diagnosed early than in later stages when it is too late. Also, you may be having other health conditions that can cause similar symptoms like bladder cancer symptoms. Therefore, the tests and exams that your specialist puts you through are vital in determining the final cause of these symptoms. Now that we went through some signs and symptoms of bladder cancer. So, how is bladder cancer diagnosed? If you have signs and symptoms of bladder cancer, your doctor may order a variety of tests and exams to be completed to confirm the diagnosis of this cancer, and these include: Number 1. Urinalysis. Even though it may not be effective like other tests and exams, to detect bladder cancer, urinalysis is used to detect and diagnose cancer cells in urine. Number 2. An internal examination. This is when the doctor inserts gloved fingers into the vagina or rectum to feel for possible lumps that may confirm a cancerous growth. Number 3. Cystoscopy. This procedure involves inserting a narrow tube with a small camera into and through your urethra to visualize inside your bladder and check for possible cancer growth. Number 4. A biopsy. This is when your doctor takes a small tissue sample from your bladder and examines it for cancer. This procedure is done by inserting a small tube with a camera and a needle through the urethra. Number 5. Intravenous pyelogram, IVP. This is when the specialist injects a special dye into your vein, and the X-rays are taken while this dye goes through your bloodstream and kidneys, and then passes into the ureters and bladder. This intravenous pyelogram test is used to get clear pictures of the bladder, and this test can show the size, shape, and position of cancer. The other test used to detect cancer is a CT scans to view the bladder. When you have health conditions that worry you, it's normal to want to learn more about the best ways to take care of yourself. Therefore, when you have developed bladder cancer, you need to be even more cautious about what to eat and what to avoid. One of the ways of taking care of yourself is maintaining a well-balanced diet that will give your body the nutrients and energy it needs to support treatment and recovery. So, is there a diet that would be recommended for people who are diagnosed with bladder cancer? While there's no one particular diet to treat or prevent bladder cancer, there are certain dietary patterns and regimens that may help reduce the risk of cancer. Before we begin to talk about specific foods that are excellent for your body when you have developed bladder cancer, the Mediterranean diet has been proven to reduce bladder cancer risk. This is because the Mediterranean diet is a nutrient-dense diet. It is rich in foods like vegetables, fruits, and whole grains. It also incorporates healthy fats from olive oil, nuts, fish, seeds. So, besides the Mediterranean diet, some of the best healthy eating patterns that you would want to integrate into your diet are: Number 1. Vegetables and fruits. We all know how important vitamins and minerals are for our bodies. Therefore, vegetables and fruits provide a variety of vitamins and minerals. We cannot talk about vegetables without talking about cruciferous vegetables, and these include broccoli, kale, and Brussels sprouts. This is because they are very rich in antioxidants. When we talk about fruits, the two main ones that we are talking about are berries and citrus fruits. Number 2. Protein sources. The role of protein is huge when having bladder cancer. This is because one of the complications of this cancer is weight loss. Therefore, when integrating protein into your diet, this helps in maintaining muscle mass and support your immune system. Some of the foods that are rich in protein are meat, chicken, fish, eggs, beans, lentils, soy products, nuts, seeds, and dairy. Number 3. Healthy fat. Knowing a person with bladder cancer needs to consume foods that are high in vitamins. However, without eating healthy fat, our body cannot absorb some vitamins that it needs. Therefore, eating foods that are rich in healthy fats is significant. These foods include fish, avocados, nuts, seeds, olives, and olive oils. Note, eating healthy fats help the body produce hormones and repair damaged cells. Therefore, it is crucial to integrate them into your diet. We all know that drinking enough water every day so that our body can function well is very important. So, can water put you at high risk of developing bladder cancer? Let's find out. Drinking water has so many benefits for our body, and we cannot live without it. However, drinking water with high levels of arsenic puts you at high risk for developing bladder cancer. It has been proven that people who live in areas with higher levels of arsenic in the water supply are at a higher risk of developing bladder cancer. Therefore, prolonged ingestion of arsenic-containing drinking water is linked with an increased chance of developing bladder cancer. It is recommended that if you drink well water, and it is your main source of drinking water, make sure you test them at least once yearly. This is to monitor the safe levels of arsenic. Note, people can also be exposed to arsenic in the environment from some agricultural and industrial sources. Your takeaway from all this is that there's no perfect way or perfect diet that you must follow to fight bladder cancer. However, you can take actions and steps to support and maintain your health at the highest level possible, following the tips and healthy eating patterns. Also, if your appetite is suppressed, make sure you connect with a registered dietitian and get professional help because your body needs all the nutrients and energy it can get to fight this cancer. Every health condition you are dealing with, especially cancer, has its prognosis. So, what is the prognosis for bladder cancer, and how fatal is it? First, let's define what the term prognosis means. A prognosis is the doctor's best educated guess of how cancer will affect someone and how they would respond to treatments and medical interventions. Therefore, it is normal for a person with bladder cancer to have so many unanswered questions about how it will affect their health and questions about the chance of survival. The doctor may not give you a 100% prognosis because this prognosis depends on so many factors. It requires a lot of knowledge and familiarity with a person's medical history and understanding the type and the advancement of cancer. The doctor's treatments and how the person responds play a big role in determining the prognosis. Besides doctors' deep research and knowledge about cancer and the patient's medical history, the doctors refer to the survival statistics to determine a patient's prognosis. The prognosis is different for each type of bladder cancer. So, the following are some of the main prognostic and predictive factors for bladder cancer. Number 1. Low-grade bladder cancer. This is when the cancer does not grow into the muscle layer of the bladder wall and does not spread to other parts of the body. This type of cancer tends to have a good prognosis than high-grade bladder cancer that has a higher risk of spreading to other organs, resulting in a poorer prognosis. These types of tumors are on the surface of the inner bladder lining, and in this case, cancer cells look much like normal bladder cells. This is why these tumors have a favorable prognosis. Number 2. How deep a tumor is and what stage it is at. For example, if the tumor has grown into the bladder wall, it is a crucial prognostic factor that your doctor depends on. Therefore, the prognosis is less favorable when the tumor has grown into the bladder wall. Another prognostic factor is how advanced bladder cancer is, which means if cancer has spread beyond the bladder into other body organs, especially lymph nodes, the body has a poorer prognosis. The prognosis for this cancer depends on so many factors. Some of them are the treatment options that your specialist uses to treat the cancer. So, what are some treatment options for bladder cancer that your doctor would use to treat cancer or stop its growth? Some treatment options for bladder cancer may include: Number 1. Transurethral resection of a bladder tumor. The purpose of this procedure is to examine the bladder and remove the tumor. After removing the tumor tissue, the pathologist examines it to determine the stage and grade of cancer. Number 2. Intravesical therapy. This is when medications are placed in the bladder to destroy cancer cells. The two main medications used in this treatment are bacil-calmette-guerin, which is used to kill cancer cells on the bladder lining, and mitomycin C. This medication is an anti-cancer drug that has been proven to decrease the number of recurrences of tumors by up to 50%. Number 3. Chemotherapy. This treatment is mostly used when the bladder cancer has spread beyond the bladder to other organs and tissue. Number 4. Surgery. The surgery is performed when the bladder tumors continue to the extent that it invades the muscle wall of the bladder. This is when the urologist recommends surgery to completely remove the bladder so that cancer doesn't spread any further. To summarize, ovarian cancer, breast cancer, and bladder cancer can be very damaging to your body if ignored or not diagnosed in their early stages. So, it is crucial to watch for their signs and symptoms for early interventions and treatments. Also, you should not delay or hesitate to seek medical interventions and treatments if you suspect you have signs and symptoms of these 3 cancers. Now it is your turn. What else can you do to decrease your risk of ovarian cancer and bladder cancer? What are some other ways to protect yourself from developing breast cancer? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.